Hello, everybody, church. I'm Ray Waters, and I'm coming to you from my den in Atlanta, Georgia. And as always, I am honored to have my very good friend Stan Mitchell coming to us from the great state of Washington. Stan, I have been looking forward to this conversation all week long.
Likewise. Why don't you take a minute and introduce our guests today? We have a couple of really special guests that are going to help us.
I'll do it. We have two extraordinary people with us today. Chante White is a nurse practice manager at Atlanta Medical Center, which is one of the large hospitals in Atlanta. She's been in the healthcare profession for nearly 20 years. She also is a dear friend of mine and has been a part of the Village Church for 8 years and has been a part of Everybody Church since its inception. Chante is coming to us today from her home in East Atlanta. Also with us, all the way across the country, is Dr. Meg McKeever, or Meg to those who know her. She is a leading gynecologist and obstetrician in Seattle, Washington. She also has been a part of Everybody Church, and she is a truly dear friend. We are honored to have Chante and Meg with us today. Ladies, thank you so much for joining us.
Thank you for having us.
Honored to be here. Hello, Everybody Church.
Stan and I have talked a lot about the role of the church in the midst of this COVID-19 pandemic. And the church certainly is supposed to offer comfort, and we're supposed to give people or help people find, I guess, a sense of meaning. But we also need to be a reliable place for information. And that's our hope today. In fact, earlier this week when Stan, Neil, and I were talking, we just kind of hit on the fact that we have Dr. McKeever and we have Chante, and they're on the front lines. And wouldn't it be an interesting program if we just talked to them and if we just gave them the floor? So we've decided, Stan and I don't want this to be the Stan and Ray time. We want to be as small in this as we can be, just asking questions of these two ladies who are on the front line. So Chante, I'm going to start with you. The governor in Georgia today announced that our schools are going to be closed through the remainder of the school year, and he issued a shelter-in-place order for the state. Metro Atlanta, where we live, has been under that order for a while, but it hasn't been for the whole state, and we have had some serious consequences because of that in some of the more rural areas in Georgia. I looked this up right before we began to record. In Georgia, through this pandemic, there have been 4,638 cases, 952 hospitalizations, and 139 deaths. We are certainly not at New York level, but we are kind of that next tier of states, Washington, New Orleans, Louisiana, Georgia, that's experiencing COVID-19. So here's the first question for you, Chante. People are primarily interested in how you and your coworkers are holding up. What has it been like for you in the hospital over the last month?
Yeah, sure. So it's really been a very stressful time. As you can imagine, our healthcare system could not have even imagined that this is where we would have been sitting, a month, even 6 weeks ago. So it's been very difficult for the nurses, the doctors, anyone in healthcare really, because we have, while we have our jobs and our responsibilities, we are essential workers. We also have a family that we come home to, and we're always, every time we walk in the doors of our home, there's a concern that we're going to expose our loved ones to whatever it is that we brought home. And that has paid a huge toll on a lot of people working in healthcare right now, because we're trying to protect ourselves, obviously with our patients, but of course we're also most importantly trying to protect ourselves from our own family. So it's been very hard, a lot of long hours. It's a very emotional time taking care of patients that don't often have a support system that you would normally have in place because of the reduced visitation and things of that nature. So it's been tough.
How about you, Meg? You kind of have been on the front lines since the beginning of this, I guess, 3 or 4 weeks ago. How's it been for you guys in Seattle?
Yeah, we were certainly we were the original site for COVID-19 in the U.S. Our governor, I have to say, was very he did a great job of catching this at the beginning and really helping people to recognize the importance of sheltering and social isolation, social distancing. Our schools closed on March 12th. At this point, they're only closed through the end of April, but I expect we probably will be hearing something similar to what you guys heard in Atlanta this week. And I have to say, Chante and your colleagues, you guys are definitely on the front lines there in the ER. I'm primarily do OBGYN. I'm primarily on labor and delivery. And that would, I'd say I'm probably second or third tier behind you, along with the hundreds of thousands of other healthcare providers that are not at the doors to the ER, but are manning the clinics and taking care of inpatients and doing our best to help, from the inside. I think what Chante was saying is really very accurate. I think the word vulnerability comes to mind here. And I think that really, personal vulnerability, obviously for each and every one of us, everyone in the country feels that way right now. Going to the grocery store, going to the gas station, we feel that every day going to work. And like Chante was saying, coming home. I mean, I think that's really been, I've been going to hospitals for the better part of 20 years, fairly cavalierly. But coming home is the part that now feels more vulnerable. I have, my parents are older. I have 2 young children, and doing everything we can, knowing that I'm sort of the weakest link in terms of their risk, makes me feel personally vulnerable. The other thing that I think this brings up, which makes a lot of people anxious, is the vulnerability of our healthcare system. I think we have, living in the United States, we feel pretty confident that our healthcare system is going to catch us. Obviously, it's not a perfect healthcare system. Clearly, there are people in need, people the uninsured, the cost of healthcare. We could go into all of that, but at the end of the day, we're all fairly confident that if you get in a car accident, there's going to be an ambulance to pick you up. There's going to be staff in the ER to take care of you. There's going to be blood for your transfusion. And there's going to be an OR available if you need it. And, at this point, with the medical system being stretched as thin as it is, and those things becoming less available, it makes everybody feel vulnerable, not only from the infection standpoint, but, having a heart attack, needing your appendix out, any number of medical things. We all, I think, it says this has revealed the vulnerability of the healthcare system in general, which leaves us all feeling a little, with a little bit of disease.
I can only imagine. Stan, what have you been thinking?
Well, I mean, the first questions that come to mind are, how severe is this going to be? Conjoined to how long is it going to go? I mean, one of the reasons that we're all looking to the experts and watching the news continually is because the question that begs is, how long, oh Lord? Are we in this for 12 months, 18 months? Are we going to be on the other side of this in 3 months? It feels like no one wants to predict positively right now, because we don't want to give people a sense of ease. We have to keep people on point. And sadly, sometimes personal interest and fear is the only thing that keeps us on point. So, the thing that I would like to know is, are we going to be back in school in August, September? Are we even able to predict that right now, from Fauci to our Surgeon General to the WHO, all the way to these 2 healthcare workers? Do we have a sense that if we do our part right now, that we're going to be back to life with some semblance of normalcy by the fall? Either one of you want to bite on that one?
Well, that's a great question. I think obviously, there's so much that is up in the air right now. I think if I were guessing, I think by the fall, we probably will be back in school. This virus is very virulent, and people are I think quite a few people will get it. I think the point of all of our social distancing and isolation right now is to prevent everybody from getting it in the same 2-week time frame. That's what's going to overwhelm the hospital systems and the healthcare resources. So, I think the point of all of this really is to try, everybody's been talking about flattening the curve, is to try and extend this out so that it's not all happening at once, but that, over the next month, 2 months, 3 months, it becomes less and less of an issue and people are able to get back to their lives. I don't think we're going back to school this year, but I'm hopeful that in August we'll be back in action.
Chante, do you have any sense from what you're seeing, from what you're hearing?
Yeah, I second what Meg says on that. I think that we are actually probably going to see a second round of this happen, even after this major peak that's going to occur. Because like most viruses, it's not just going to go away from social distancing. The key is really so that we're not overwhelming our healthcare system, so that we really can take care of those vulnerable populations that are really going to need that inpatient care. So I hope as we know, as of today, Governor Kemp here in Georgia has closed schools through the end of this year, end of this school year. But we'll see what happens come August.
One of the things that I've also wondered, Chante and Meg, is where does COVID-19 go? Does it go into the medical portfolio with polio and measles and, SARS and Ebola and the mumps and chickenpox and the Spanish flu of 1918? Where does this go? Does it just become this nagging cold that we deal with the rest of our life? Or is it perpetually going to be unprecedented? Is it going to have continual residual impact at a higher level than these other maladies that I just spoke of?
Meg, you want to take that one, or you want me to mention something?
Sure, yeah. I think in the short term, where it goes, I think in the short term, it likely will go to South America. I think it's likely that, as all of these kinds of viruses tend to have a seasonal element to them. And I suspect that South America is getting ready to have their boom. They're going into the winter season as well. I think certainly with the number of people who are at risk and who are going to be exposed, as Chante said, with a second wave of illness, getting into the fall, my sense is that this is probably something that will linger, on the periphery for quite a while, until hopefully we are able to either find a way to prevent through vaccine or through medications. There's a new study that's getting ready to start here this month in Washington for prevention. So using hydroxychloroquine as a preventative medication for people who are exposed to prevent them from becoming ill from it. I think that's our best hope at this point. I think that's probably what I see in the short to medium term.
Yeah, I think that the fear a lot for healthcare in general, and I think you could probably agree, Meg, is that we don't really know how to tackle this right now. We've never, experienced this particular strain of coronavirus before. This is brand new, as you all know, and we don't have medications that we know for sure are going to work. So there are a lot of trials out there. They're trying a lot of different things to determine what we can do to help reduce the risk, or hopefully, heal some people that are really bad off.
Why is this different than the swine flu, SARS, Ebola? It seems like the immediate effects aren't quite as virulent as the measles, and it seems like the immediate effects are, comparable to some of the other illnesses. Is it the virulency of this? Is it the lack of an immunization? What's making this so bad compared to other outbreaks?
So, it's highly contagious. It is, you can get it through droplet, which is a very easy way to transmit any type of bacteria or virus, kind of the same as the flu. Well, it's not the same as the flu. I don't want to say that because I'm only comparing that because we have seen, the same type of evolving of something. Of course, not to this magnitude, but it's very infectious, being that it's a droplet type transmission. So that's what I would say.
Just like Chante was saying, part of the issue is the virulence. Part of the issue is the asymptomatic carriers, and the fact that there is a large, we're learning more and more every day, but there are a large percentage of people who are infected and don't realize that. And they walk around, continuing to go to the gym, continuing to go to the grocery store, continuing to, go to their doctor's appointments and visits without realizing that they're spreading this infection. They're bringing it to the nursing home where they work. They're bringing it to the daycare center where their kids are, and so there's this latency period where people don't realize that they're sick and they're able to spread it. With diseases like Ebola, by the time people were sick enough to spread, that disease was very devastating. But when you got it, you got so very, very sick that you were debilitated, and you weren't able to, you physically were unable to travel very far, and so you really couldn't spread it very far. But with this, the latency between infection and symptoms, which, we're learning more and more. As I said, this is all unfolding around us, but that seems to be one of the big differences here.
Chante, I was just curious. We have kind of been hearing about this for the last month. How did you think Atlanta did on the sheltering in place? I would go to parts of town and it seemed like nobody was really paying attention to it. And then I have other friends who have been very diligent from the very beginning. They seem to pick up on it right away. But I was just curious what your take on kind of how we have done in Atlanta on that.
Yeah, so I don't think we did a great job. I think that over the course of the last week or two, it's gotten better, but there are still a lot of people that have not taken this seriously. I am also oversee an outpatient clinic that sits right on the Beltline here in Atlanta. And every day I'm seeing people in large groups, grouping together, conversing, like, nothing is wrong. And I have not been afraid to go out and speak and say something to them, because they're really the ones that are, like Meg said, the asymptomatic ones that are spreading it unknowingly to one another. So I think we're getting better. I think that now that we have this statewide shelter in place, that it's not just the city of Atlanta. I think that more people are opening their eyes and recognizing the importance of this. So I would say it wasn't great in the beginning, but it's getting better. Yeah.
Wow. I'm glad that people are finally clicking in.
Yeah.
That's really good. Meg, how about your observations concerning the Pacific Northwest? Did you guys jump on board right away, or was there the resistance that we have had in the South? What was your observation?
Yeah, well, as I said, they closed schools on March 12th. And then soon after that, they started really with a push for social distancing, which was left pretty open for people to interpret themselves. I will say this part of the country, we have a huge tech presence. So Amazon, Microsoft, there were a lot of companies who very quickly jumped on board with the work from home and were able to do that very effectively because they, many of their staff are very tech savvy and were set up for remote work anyway. So in that way, we were, but it's also, it is, the weather's been gorgeous out here and it's springtime and everyone in Seattle has been stuck inside in the rain for the last, 6 months. And so there have been a lot of people doing outdoor recreation activities, and they had to, just last week, they closed our parks and rec because they needed to close up the state parks. There was just too much traffic on the trails. It's hard to socially distance when you have to pass, on a 2-foot wide hiking trail. So I think in the last, and then of course last week we had a stay at home order, which is not quite as, I guess, drastic as a shelter in place, but similar. And I think since that time, people really have, I of course have to be on the roads going to and from work. And yesterday I was driving home from work at 4:00 and, there were, on I-5, this huge highway right through the middle of town, there were probably 5 cars. So I was impressed, at the lengths to which people are going to really take that seriously.
Yeah, traffic has really been way better in Atlanta. I'll say that. A lot better.
A bright spot. One thing that a couple of things that I've been wondering about practically, are we all going to be immunized, inoculated a year from now? Is this going to be added to the cocktail? And I don't want to get into the controversy of immunization here, but is it going to be added to the cocktail that our kids get for chickenpox and malaria and all of those things? Or is it going to be like a flu shot you get at the beginning of the year? How do we respond to this when the immunization comes out? Who's that for?
Well, let's hope that we can get that immunization and it's effective.
Right.
I'm gonna say that first for sure.
That's not a guarantee.
Right.
Right. And if we do, I mean, to get it mass produced, that would probably be 8 to 12 months at best before that is available. So obviously there's a lot of time between now and that possibility. But yes, I mean, I would hope that it would become as available. You may recall in the early 2000s, 2010, there was the H1N1 outbreak. We all went and stood in line at the drugstore to get a vaccine, separate from the flu vaccine, which we had all gotten that season. We then had to get an H1N1 vaccine. My hope is that it would be like that. I do think, given the virulence of this, I mean, I'm fairly confident that I will be exposed, and Chante will be exposed, hopefully, in a very mild way. I have a number of friends who have been infected. Unfortunately, most of their courses have been pretty mild. But again, it's not just those of us who are infected, but the vulnerable populations around us who are at risk, and we need to do everything we can to protect them.
University of Washington has become kind of the go-to for information. It seems like, in fact, Meg, I think that's right, really close to where you live. I think they have kind of been on the forefront of putting out data, and they first were doing it just for Washington, but my understanding is now they have run numbers for all the states. And so I'm saying that because today, as I was listening to our governor speak, he talked about April 23rd being a very significant day because that is the anticipated day when we will hit critical mass, I guess, when we will actually be full. The hospitals will be full and we'll be really, really tapped. Have you guys hit that in Seattle, Meg?
Well, the good news is that all of this social distancing seems to be working to flatten the curve here in Seattle. Nobody wants to speak too soon on that, of course, but we are seeing, it's predicted at this point. I was just looking at some graphs this morning. It's predicted that our peak would be around Easter, in the middle of April. The better we do with the distancing, hopefully the farther out we can push that and hopefully not reach that point. But the great thing is that the farther out we push it, the more our hospitals and our hospital systems are able to increase capacity. We're able to get the protective equipment that staff need. We're able to create field hospitals and get the Navy, Mercy and Comfort in place to be able to take some of the pressure off of our hospitals. And so, to increase the capacity that we have to manage this. And
you guys, y'all are like building field hospitals right now in Seattle.
There are, yeah. We have the football stadium is in the process of being modified to become a field hospital. There's a soccer field in Shoreline nearby that they're modifying to become a hospital. They've taken a lot of the ambulatory surgery centers, which are no longer doing surgery, and creating space there to expand the capability for ICUs and medically unstable patients. So I've been one thing that has really come out of this, that bears repeating, is that I've been incredibly impressed by the unity that this has created in healthcare systems and in the country as a whole. But I've been in multiple multi-hour phone conversations and emails, and I get multiple messages every day about these contingency plans and just many layers of preventative and preparatory work that people are pulling together on very short notice to be available. And that's really impressive to see to see the teams uniting in that way.
Chante's wife is a paramedic. Her name is Crystal. And I'm just curious, is Crystal seeing things different, like on the street?
So definitely there's been an increase of calls that she's running for patients that are either COVID positive or that have suspected symptoms. But then you have to add into that all of the other just normal day-to-day emergencies, the heart attacks and the strokes, and everything else doesn't stop happening just because we're in the middle of a pandemic. So they're extremely busy. I think the scary thing for all of our EMS workers here in Georgia and all around the country is they're our first line. They are really out there in the front lines, seeing these patients with very little protection, minimal protection compared to what we have in the hospital setting. So their risk for exposure is extremely high. And so they've, of course, put additional measures in place to ensure their safety. But regardless of all of those things, you still cannot replicate the hospital setting as far as that goes.
Is it inevitable right now that high density areas like Chicago, Houston, LA, Dallas, Fort Worth, Atlanta even, are they on track to repeat New York City? Or has New York City been the effective canary in the coal mine that has thwarted and made these other cities take this seriously, and we're not going to have that repeated? I mean, we're sitting at 4,000 to 4,500 deaths right now, and the speculation, some say best case scenario, is we're going to end up at 100 to as many as 250,000 deaths. We're a long way from that now, so that sounds like a long, torturous, sad, grievous ride we've got ahead of us. Is that going to include these high-density areas, following New York City, I suppose? Sorry for repeating the question, but you get the gist of it.
Well, certainly we all hope not. I think, it's been unfortunate, obviously, to see what's going on in New York City. And, it's been said before that all of these efforts that we're taking right now, if they work, it's going to look like we've overreacted, right? And if they don't, then we're going to wish we had done more. And I think in Seattle, to some extent, we have been able to stave off the big wave that everyone was anticipating so far. And so that makes it look like we're overreacting. And for better or worse, as the rest of the country looks at New York City and sees the experience that they're having, I think it really makes it feel real, and it's horrible to, that would have to happen for people to take it seriously, and for people in Denver and Houston and all across the rest of the country to really start to pay attention to these recommendations. But my hope is that there could be some silver lining to that.
Are we going to be wearing masks? And I don't have the fancy 95 mask. Is any mask helpful? I mean, are we really going that direction where we're all going to be wearing them even if we step outdoors or indoors?
So an N95 mask is not necessary for the general population. Even in healthcare, they don't recommend that we wear the N95 mask unless we actually are doing some type of aerosolized treatment for a patient, or if a patient is on a ventilator, then we would be wearing that N95 mask. Otherwise, we wear surgical masks to help with droplet precautions. I know there's been a lot of controversy about whether you wear the mask or you don't wear the mask. I know that our Surgeon General says one thing, our president says something else. So it's really hard for the general population to follow. I think most importantly, there's no harm to wearing a mask, but sometimes you can end up infecting yourself just by the removal of that mask, especially if there's particles on the outside of the mask. And the general population doesn't often know how to appropriately, what we call don and doff, those types of PPE, which is everyone's hearing about. So that's, I think, the fear in telling people to wear a mask, the general population, because there's that fear of them not knowing how to remove it appropriately and dispose of it appropriately. But if you do know how to do those things, then there's no harm in wearing one. And, it certainly doesn't mean that it's okay for you to not practice social distancing, and it doesn't mean that you shouldn't still continue those abiding by those important standards that we're trying to set right now. But it can definitely be helpful.
I heard that the CDC is considering a policy of recommending universal masking. And so, but again, this is something that's changing every day. I mean, 3 weeks ago, we didn't think masks were helpful. We all thought that it was, or masks for the general population, it was thought to be something that could only be spread through, we were just having people cough into their sleeve, right? Because that was going to solve the problem. But as we're learning more, it's looking, we have all this asymptomatic carriers. We have more evidence that it may be not just droplet, but aerosolized secretions too. So, walking by somebody who's breathing heavily on the trail, could that potentially be an exposure? We're learning that maybe it could be. And so that's where the proposal for universal masking has come from. And in that case, it's really any sort of mask, any barrier between, that's why people have been talking about bandanas and homemade masks, any barrier between your face and the aerosolized particles that could be, that you could be exposed to out in the world, that's the concern. That's where it's coming from.
I've been wondering a lot about the test. I watch the news and I hear governors saying they don't have the test. And then I hear people saying we have the test. And so, Chante, in Georgia, are we doing good? Do we have adequate tests? Are we picking it up? Kind of what's going on?
So, we have picked up some on our availability of tests. We have more testing sites every day. They're increasing our availability to test. But we are definitely nowhere near where we need to be in order to test every person with symptoms, if that's what our goal is. Our recommendation to those individuals that have mild symptoms is to go home and quarantine for 14 days. We oftentimes don't have a test to be able to ensure that they actually have COVID-19, but we are assuming that they do with their symptoms. So many healthcare hospitals and outpatient clinics are testing only those individuals that they deem would need to be actually admitted to the hospital because of our continued, shortage of tests.
Yeah, and I would say also to add to what Chante was saying, because of the burden on the labs as well. So the tests are becoming more available, but the more people who have a cough and want to get tested, the more the labs get bogged down, and then it becomes harder for the paramedic who is trying to figure out if they need to be out of work for the next 2 weeks to get that test result in a timely fashion, to then be able to return to work and continue to care for people in need, especially as, healthcare providers do start getting sick and start needing to go out. Part of the concern is that we're going to have a shortage of staff. So that's another limitation on the testing.
When Neil put on Facebook a day or two ago that we were going to be doing this interview, some people sent some questions in. I thought it was wonderful. They seemed to genuinely be excited about what we were doing. So I wanted to ask at least one of those questions. Beth asked if there's information that perhaps government and public health officials haven't emphasized that you two, much closer to the front lines, would say, hey, this is important, and maybe you have not been hearing it as much as we think you should.
So I hesitate on answering that question. But I would say that I think what we need from the American people is a lot of prayer for our healthcare workers and for the individuals that are fighting this right now. I think that we have a lot of good measures in place that we hope are going to be impactful to us fighting this pandemic. And I think what we need is some positivity and some encouragement, and for people to not be living in fear, which I think there's a lot of that right now. I think that we just need to take a step back and do what we need to do and keep ourselves healthy and take it day by day and Yeah, and just be hopeful and pray for those that are in the front lines of all this.
There's so much information that it's almost overwhelming for people. And I certainly don't think that anybody knows anything that they're not sharing publicly. I don't think the government, it has any secret tips up their sleeves that we're not hearing about. But I do think the risk is almost in oversaturation of information, and the fact that, that health is not just whether or not you have a fever and shortness of breath and symptoms. It's also, are you sleeping? Are you taking care of yourself? Are you telling the people around you that you love them? Are you exercising? Are you keeping yourself healthy in all these other ways, which also support your immune system and help to give you, some other levels of protection if you are exposed, so that maybe your course could be more mild. And taking care of those who are vulnerable around you, calling your elderly neighbor and seeing if they need anything from the store, checking in, with friends and family, healthcare providers that you know and love. That's been wonderful to hear and see all the support from people.
No, I was just saying, I think being a good neighbor is so important right now. And for us to, Meg, you totally took the words out of my mouth when you talk about the importance of checking in on those vulnerable people in your life and your neighbors and those people that can't go out. And for goodness sakes, we have enough food and supplies in this country. There's no need to hoard when you go to the grocery store. You go to the store, get what you need, and save some for other people, because we have to come together as a community to get through this.
Someone else submitted a question. There are rumors, this person says there's rumors that there's more than one strain of the virus, and it's the difference between whether someone gets a mild case or a severe case. With you two on the front lines, do you know anything about that? Has that been anything you've heard?
I haven't personally heard anything about that. I think there's just a lot of conversation really more about viral load and how much viral load it takes to show symptoms. But as far as different strains, I haven't heard anything about that. I don't know about you, Meg.
No, I agree. I haven't heard anything about that either. I have heard that sort of the viral load, the severity of infection, can have some implications as well for like the potential for reinfection. There have been a few cases of people testing positive for COVID-19, testing negative, and then becoming positive again from a re-exposure. And that it seems that people who have maybe a more mild case may be more likely to have that kind of re-exposure. But I haven't heard about different strains being an issue.
As I'm sitting and I'm listening, I realize I don't think I understand what viral load is. Fill us in on what that is.
I'll let you do that, Meg.
So viral load, basically when, with any kind of virus, when you're exposed to a virus, you part of your immune response is determined by the amount of virus that you're exposed to, and that quantity of virus that you are exposed to and that you form an immune response to is called the viral load. So in certain, we talk about a lot in HIV and people who have had success with treatment and on their antiretrovirals, their viral load can fall to a very low or even undetectable level. They still are considered to have the disease for a certain period of time, but that viral load is something that we assess to figure out the severity of illness.
I do have a question. I have a question for both of you, and that is, Chante, Megan, if you contract COVID-19, how long are you out of the game? How long do you have to stay away from your work?
So the recommendation, of course, is a 14-day quarantine if you have been exposed. Of course, what we are seeing a lot of here in Georgia is that patients will have mild symptoms and then they get progressively worse. So our recommendation, of course, is at least 3 days after you are fever-free with COVID-19, then you can return back to work. That's our current policy at our healthcare organization. But of course, that's going to be on a case-by-case basis.
Yeah, I agree. We're saying the same thing here, a minimum of 14 days. Like Chante said, a friend of mine who was exposed and became sick in the beginning of March, is still recovering. And of course, we're now 3 weeks later, well outside of that 14-day period, but a minimum of 14 days, but with the caveat that it would be 3 days symptom-free without medication.
Are you seeing effectiveness in terms of healthcare providers staying free of the illness? Are the preventions working? Are there hospital systems that are being overrun with, their doctors and their nurses and their phlebotomists and pharmacists getting sick? Or are we doing pretty well with that right now? Because I have heard concern, what happens when our frontline workers go down? Are they going down? How's that going?
The biggest liability is truly in our frontline workers, people like Crystal, who, the paramedics, the police officers, like Chante, the ER staff, because these are, patients are coming in off the streets with symptoms, which are sometimes obvious and sometimes more vague. And then they are exposed. I think as people are becoming more aware and we're taking precautions more seriously, hopefully that risk will decrease. But even in our world, I did my residency at a hospital in New York. And there was a situation there recently where a husband or partner came in to join his partner who was in labor for the birth of their child. And he lied about his symptoms because he didn't want to be separated from his partner. Unfortunately, then she became sick. And in the process, there were dozens of healthcare workers who also were exposed and became ill. So, I'm hopeful that it will become less and less, but it's still very, very real risk.
Absolutely. We are seeing a lot of exposed healthcare workers here, at least at the hospital that I work at. And a lot of them are having to be quarantined. We haven't had any with any severe symptoms where they have had to be admitted to the hospital. But just over the course of the last 24-ish hours, we implemented a new policy for all of our healthcare workers that everyone preemptively wears a mask anytime they interact with any patients, regardless of whether or not they have symptoms of COVID-19. So the hope is in doing that we will obviously reduce our exposure as much as possible.
Yeah. I have heard, I think there was something like 100 Seattle area firefighters that either had been on quarantine or were now back from work after a quarantine. Because again, the exposure out in the field is real.
Yeah, 1,400 at NYPD have tested positive for coronavirus. Can you imagine 1,400 police officers? And I know they have an incredibly large force there, but 1,400 is a significant chunk.
I want to ask one more question, and then I want to turn it over to Stan for him to end this however he would like. But before I ask the question, I want to say to both of you ladies, thank you. We could have searched the world over, and I don't think we could have found two better representatives, nurse and doctor, to be able to talk to us about what your sense is of what's taking place kind of on the ground. And so thank you. And you are both dear friends to us. And we just love you. And we are praying for you. And we appreciate so much what you are doing. My question is, I know this has to be exhausting emotionally, physically, the things that you're having to carry in your mind every day as you're around people who perhaps have COVID-19. I know it can be down. It can be kind of a frustration. And I'm just wondering, do you have overall a sense of hope that not just that we're going to get through this, but that maybe we're going to get through this and it's going to be, we're going to have grown, perhaps? Just curious, your sense of hope about it all.
So I have a lot of hope for what this is going to do for us as a country and really, I think, as a world. I think that what this does is really, we recognize how connected we all really are and how important it is that we have measures in place that we can protect each other across the globe. And I think that's become very evident with this pandemic as how connected we all really are. And it's amazing to me to see the community come together in this type of situation and really see them supporting each other, even in the distancing that we have to make. I think that there's just so much good in the world. I think sometimes we're always talking about the bad. And I think in times like this, we really are seeing incredible people coming together and supporting and wanting to do everything they can for their community. So I hope that continues. I also think that we sometimes forget how important and vulnerable our health is. And it's critical to our survival. And we, especially in America, I think sometimes we take it for granted. And we don't necessarily have, I don't want to get real political, but we don't make it a priority for the citizens of this country, for everyone to receive good health care. And I hope that, if anything, this situation really opens up a lot of people's eyes to the importance of that.
Yeah, I agree with everything that Chante said. And I do think I have immense amounts of hope and optimism that we are going to get through this, certainly. And that on the other side of this, that first time you sit in a ball field to watch a baseball game, that first symphony performance that you go to, I mean, that sense of community, that sense of unity, that I can't wait for that to happen. And in the meanwhile, I see that empty highway yesterday as an incredible act of love. I think that's just an amazing thing that we are doing. We have the capability to do this, to gather together, to do what needs to be done, to protect the people among us, and to show them that we love them, to show them through the walls of, through the glass at their nursing home, to show them through the text messages and the chalk drawings we do on each other's driveways, the checking in that everybody is doing. I mean, this has brought out the worst in some people who are scared and afraid, and it's brought out the best in some people who really show that ability to pull together and unify in this situation. So hopefully that will stick with us when this is all over.
Well, Ray, I don't know where to go from there. That was both of those were eloquently put. I think the only thing that I would ask, that I see some of our Everybody Church folk asking, is, how are you guys doing? How's your mental health in this? How's this wearing on you? Does this make you feel more than ever that the Hippocratic Oath is a calling and that you're doing something really important? Where's your psyche in all of this? And how are you guys keeping yourself strong? Because I'm listening on the news continually to doctors who are afraid and frazzled and just at the end of their rope psychologically. What can we do for you? How are you doing?
Well, I'm tired. I'll say that. But mentally, I can't imagine doing anything else with my life. This is absolutely, healthcare is a calling for me. I truly believe that I am doing exactly what I was put on this earth to do. So I'm not fearful. I am hopeful. I am, of course, most of all, scared for my loved ones, as I said before. But I am encouraged by the team that I work with and the people that come together. And it's just a reminder that, I could choose to put my hands up in the air and say, you know what, I'm done with this. I'm going to, shelter in place. I'm not going to go to work. I'm going to stay here and take care of my loved ones and my children, and my wife and my parents. But I also know that other people out there need me too. And so there's a sense of pride in my profession right now. I'm very proud of the people I work with, and the people that are really stepping up and doing all that they can. So I'm tired, but I am also very proud to be able to make a difference.
That's great. Yeah, Chante, would echo those sentiments. I would say it depends on which day you ask me. Some days are definitely better than others. And, I think, certainly scared. I mean, I think that's the, as a healthcare provider, my role in my family has always been the person people turn to, the person they look to for advice, the person they call. The other day, a friend came over with a busted up finger, wondering if he needed stitches. I'm used to, these shoulders, carry that, and I'm honored, and I love that. And this is a unique situation where I feel like I am actually their biggest risk right now, that everybody is doing such a great job of sheltering in place. We've isolated all the grandparents, we're staying home. And somehow I'm the one that they need to be protected from, which is a little bit of an unsettling feeling that I'm growing more used to, unfortunately. So I think that is an element as well that I'm getting accustomed to. But overall, I would echo, just as Chante said, that sense of hopefulness, that sense of unity, the sense, people in the community reaching out, offering support, people in my office, people in my hospital, people on labor and delivery, just reaching out and offering to help in any way that they can. And that is just beautiful. It's been humbling and impressive and beautiful.
Well, I want to say thank you to Chante and Meg. This has been remarkably helpful for me. I hope it's been helpful for a lot of folk in our Everybody Church community. We definitely need one another right now, and I'm grateful to have smart people among us who can help guide us through this. I suppose this is going to be an ongoing conversation. That's part of the thing about, it's one of the things about Everybody Church that I love, that we can continue the conversation. If you have questions for Meg, Chante, please feel free. Send those in. We'll try to communicate as much as possible. I could even expect that we'll be doing this again with them, maybe adding some others, because this is not going away anytime soon. So we want to be here for you in every way possible. So on behalf of Everybody Church, to two of our people, Chante and Megan, thank you from the bottom of our hearts. Take care of yourself, everyone. Be safe, and we'll talk soon. God bless.
Thank you, Stan. Thank you, Ray. We love you, Everybody Church.
Yes, thank you so much.